Hi there, and welcome back to my YouTube channel, Dr. Coco's Medmonics. Today we're going to be talking about shock, and you'll get a question stem, and your patient will have vital signs showing a high heart rate and a low blood pressure, and you're thinking automatically this patient's in shock. Well, what even is shock? I mean, it's literally just your organs are not getting enough blood or nutrients to keep doing their function. So what I've noticed on STEP questions that they ask the most about is what's happening in these 4 different types of shock as far as your preload, your cardiac output, and your systemic vascular resistance. And I found it really hard to remember which way the arrows are going, especially when you're under high amounts of pressure during the test. And so I came up with this way to remember the 4 different types of shock and what arrows go up and which arrows go down. And so first I want you to notice that both the first 2 have 2 letters bolded, and the third and fourth ones have 1 letter bolded. And these bolded letters will help you on test day. I even wrote out the word hypovolemic shock just to figure out which 2 letters are going to help me figure out these lab values. And so what I want you to remember as we go through these is think of which values are going to go down. And if you can remember that, and you can remember how to spell, then you should be able to figure out which way the arrows go. So first we're going to talk about hypovolemic shock. This will be like a hemorrhage, dehydration, or a burn. And so in hypovolemic shock, we have the P and the O bolded. So both your preload and your cardiac output will go down, and your systemic vascular resistance will go up. And this makes perfect sense if you think about not having enough blood. You're obviously going to have a lower preload, and you're going to vasoconstrict. Next, we have septic shock, which is under the umbrella term of distributive shock, and also includes anaphylactic shock. But if you remember it as septic, the S and the P, then your systemic vascular resistance will go down, and your preload will go down. And then your cardiac output will be up. So if you can remember the S and the P, you can remember which levels go down, which would be systemic vascular resistance and preload. We next have cardiogenic shock, and this would be something like a heart attack, heart failure, or maybe an arrhythmia. And cardiogenic starts with the C, so we can guess what levels will go down, the cardiac output. And then our systemic vascular resistance would go up. Because our heart's failing, we're going to constrict. Last is an obstructive shock. This will be an obstruction of the outside of the heart, so cardiac tamponade, or maybe like a tension pneumothorax, maybe even a PE. But obstructive starts with an O, so we can guess which level is going to go down, the cardiac output again. And because our cardiac output is down, our systemic vascular resistance will go up. So if you can remember the 4 different types of shock, and even in test day, if you want to write down the word septic and S and P, if you can remember the S and the P go down, this will get you points on test day.